So this video is just discussing the importance of nutrition in both surgery and really for all the patients that we see with shoulder pain. We know that the vast majority of the patients that we see are deficient in their protein intake and also several very important vitamins and nutrients in their diet. And when someone comes in and they have shoulder pain, often, their body is weak because of the pain, so they're more pain, so they're weaker and all these things. And so let's just talk about surgery in general. When we go in and we operate on your shoulder, you start to lose muscle very quickly after we do the surgery because there is a period of several months where you can't, use that joint because you're letting everything heal. So what do we want? We want less pain. We want to minimize how much muscle you lose so that we can speed up your recovery. Well, something that's vital in this is your nutrition, right? And so what we did was, myself and a group of shoulder surgeons developed a protein powder that is specifically formulated in a way that optimizes your nutrition coming in and going out of surgery. And I think we also offer this to all of our patients because everybody can, their lives can be improved because of better nutrition, better muscle, right? So the main things that the nutrition focuses on are protein intake, and there's 2 essential amino acids that are lacking in the majority of protein powders and bars you find on the market. And these are very important with minimizing muscle loss after surgery, and that's leucine and glutamine. And this has been studied extensively. So we really dove deep into the peer-reviewed literature, looking at the orthopedic surgery literature to find out, what data is out there on what vitamins and nutrients we need. How do we properly formulate this powder to make sure that it's optimal for our patients? So the thing that makes this unique is the levels of leucine and glutamine that are in it. And then also, there's a vitamin C, which improves tendon healing and decreases pain, vitamin D, which we know improves tendon healing, and then magnesium, which is a great pain reliever as well. So it's really, taking all the science out there that we have and looking at what we know as surgeons and putting together a formula that's optimal for you to be taking coming into surgery and then going out of surgery. And our recommendation is to do it for 2 weeks before, and my recommendation is for the first 3 to 6 months after surgery, and then as much as you like after that. And also recommending it to all of our patients who are coming in with shoulder pain, because almost all those patients could benefit from improving the amount of protein they have in their diet and their muscle mass. Another part of the supplement is if you're having surgery, there's a carbohydrate loading drink that you drink the night before, which will decrease nausea, decrease vomiting, and then speed up your recovery coming out of surgery the next day. So you'll bounce back much faster by taking this drink the night before surgery. So the bulk of it is taking the daily protein powder, but for those of you who are having surgery, taking the carbohydrate drink the night before is really going to help you bounce back. And there's a ton of literature and science behind these supplements. So I hope you enjoy them. And we preach healthy lifestyle, diet, all those things. And this is something that we've put together and spent several years doing it with nutritionists to make sure that you have the best outcome possible.